Hi there, I'm Dr. Margot and I'm the naturopath here at Think Chiropractic Wellness. And I just wanted to chat a little bit today about childhood eczema. Eczema is definitely something I see a lot in my practice, and it's something I work with families towards helping. So often with eczema, we actually see a triad of symptoms. We call it atopic or the atopic triad. So that is eczema, asthma, and allergies, and these three tend to go together. A lot of times when children have eczema, the parents are looking for alternative treatments to steroid creams, which is often what they have been prescribed. So we can work with them to try and get in the root cause of what's causing the eczema to begin with. So how common is eczema? Actually 10 to 30% of children in the developed world will get eczema, so that's quite a high number. And it does have a hereditary component to it. So if the mother and or the father did have eczema as a child, then there's a higher chance that the child will get it in their lifetime. And most often it actually develops, more than half the time, it develops within the first 6 months of the infant being born. So what causes eczema? There's a few things that play into it. So one is the immune system. So if the immune system is dysregulated for some reason, that'll lead to a higher chance of developing the condition. Also impairment in the skin barrier. So our skin has a certain build, it has different components to it, and so if that starts to break down for some reason, that can lead to the eczema getting worse. And the third is just some allergic inflammation that's happening. So when you think of eczema, it's red, it can be oozing, so that's where we get that inflammation there as well. So there's a lot of things that can contribute to eczema, so definitely foods can play a component, sweating, any physical irritation, things in the environment, exposure to different microbes in the child's life. So definitely what I do with my patients is we sit there and we look at, what is contributing and to what degree. Is there something in the cleaners or the detergents or the clothing? Are there pets around the house? Is there a food that the child's eating? Or if they're being breastfed that the mother's consuming and then it's going into them? Did they have antibiotics at all, which can throw off the microbes in the body, or is their immune system weakened for some reason? So it's not the same for everyone, but we definitely dive into why that's happening. So there's a lot of things that can happen. So for example, for the microbes to be off, we know that most of our immune system is actually in the gut, and that dysregulation in the gut microbiome is one of the factors that contributes to eczema. So especially in infants or young children, there's a lot of factors that can play into it. Were they born by vaginal delivery or C-section? Did they have to use antibiotics, or did mom have to use antibiotics? So that's all going to play into that as well. So if we want to do some easy treatments at home, or a good place to start, so first would be looking at the diet for sure. More often than not, dairy does seem to be the leading food that's playing into it. Not for everybody, but I would say a lot of the cases. So whether it's baby that's consuming the dairy or mom. And when I say dairy, I don't just mean cow's milk. So there's also cheese, yogurt, ice cream. It can be added into milk ingredients, into different processed foods. So definitely looking at how much of dairy is being consumed there. Also in the formulas as well. So if it's a baby who's being formula fed, often trying to switch the formulas around can make the eczema better or worse depending on what's in it. Other things that can contribute, we have gluten, soy, eggs tend to be the top ones there as well. In terms of the microbiome, so we can definitely help balance out the microbiome. So depending on the child's age, there's different foods that have high probiotics in them, or a probiotic supplement for mom or baby. So there's different types and strains. So that's a good thing to try and find the probiotic that fits best for you. And then another thing you can do at home is, as long as the child's not sensitive to oats, would be an oatmeal bath. So that can be a great way to soothe the skin. So if you grind up some oatmeal and you put it in a sock or a nylon, you can use it as a sponge when you're giving the child the bath, and that can be often really relieving for the skin as well. The last thing that kind of goes along with the bathing is just locking in the moisture. So you'll always see, don't let the skin dry out, because if it's dry already, we don't want to add to that. So often what they recommend, and what I recommend as well, is that within 3 minutes of having a bath, we want to get that moisture locked in. So something like coconut oil is really great. It helps lock that barrier, and it's also a little bit antimicrobial, so it can help prevent any infections. So that's always a great place to start. So if you have any other questions about eczema in your child or yourself, feel free to reach out to us at Here Think Chiropractic, to myself or any of the other practitioners. Thanks for listening. Bye.